Hello and welcome back. So, when you see me here, you know it's Matters Health, and today I want us to discuss a very important topic called sexually transmitted infections or STIs, or in other words, previously known as STDs. Now, if you're new here, please consider subscribing to our YouTube channel at Dr. on Wheels. And you can also follow us on our social media platforms at Zawadi Premier Hospital underscore Gong for our Instagram, and Zawadi Premier Hospital Gong for our Facebook page. But also you can follow me at a personal level at Dr. Tsuma on TikTok. But before we dive into today's topic, I want us to listen to some words of wisdom from the book of Deuteronomy chapter 31 from verse 8. The Bible says, "It is the Lord who goes before you. He will be with you. He will not leave you or forsake you. Do not fear or be dismayed." And that is the word of the Lord. So, have you ever had at any given point in time in your life where you have an abnormal vaginal or urethral discharge? Okay, this discharge can be purulent, it can be pus-like, it can be false-smelling, okay, or you feel like irritation around your genital area, you feel like scratching yourself always, okay, or some burning sensation around the genital area, or some wounds around the genital area, okay, some blisters, okay, or have you felt pain when you pass urine? Okay, or have you felt pain or even bleeding after sexual contact? Okay, so those basically might be the only signs or symptoms that someone might be having a very serious condition called sexually transmitted infection. So by far, what is sexually transmitted infection? So sexually transmitted infection are diseases, okay, or infection that are primarily transmitted through sexual contact. They can be transmitted through other ways, okay, but primarily they get into your body through the sexual contact. Okay? Yes, so the sexual contact can be the vaginal, the normal one that everyone knows, but then there are other people who find satisfaction through other means of sexual contact, like anal sex, okay, or oral sex, okay, so they can still be transmitted through all those routes, okay. So, these diseases can also be transmitted through other means, like they can be transmitted through what we call congenital transmission or vertical transmission, where a mother has the infection and they can easily pass that infection to their baby through the placenta. The second thing is for the intravenous drug users. If you're a person who injects yourself with those drugs and you share needles, it's very possible for you to actually get the transmission from your friend when you use those needles. Or when you go to the hospital and you receive blood, and by mistake you receive blood that has been infected with this disease, okay, you can easily get this infection. So, or even a breastfeeding baby, okay, so you breastfeed a baby and the mother is infected, and if care is not taken, they can actually, the baby can actually get this type of infection, okay. So we are going to group these infections into the type of microorganisms that are causing this infection. So with bacteria, so we'll have bacteria, viruses, protozoas, fungi, and even ectoparasites. Okay, so for the bacteria, the major one by far that you need to be able to know is gonorrhea. Okay, gonorrhea is caused by a bacteria called Neisseria gonorrhea. And then the other one is chlamydia, which is very notorious in causing pelvic inflammatory disease. Okay, so it's caused by chlamydia trachomatis, and then you have treponema pallidum, which causes syphilis. Okay, and then the other one is Haemophilus ducreyi, which causes an infection called chancroid, which is basically a painless wound on the on the genital area. And then for the viruses, okay, we have a human immunodeficiency virus, or what we call HIV, that is transmitted sexually. And then we have the human papilloma virus, okay, and the human papilloma virus is known to cause genital warts, so there are some small growths around the genital area, but also it's known to cause cervical cancer. And then another virus of importance is herpes simplex virus. Okay, so we have herpes simplex virus 1 and herpes simplex virus 2, and this one has been known to cause what we call genital herpes. Okay, so blisters, itchiness, and all that around the genital area. But it can also the blisters can also be found in other areas of the body. And then another virus of importance is hepatitis B virus, which is transmitted sexually, and it basically causes hepatitis, which is one of the most lethal viral infections that you wouldn't want to get. Okay, more lethal than HIV. And then for the protozoas, okay, there's a protozoa called Trichomonas vaginalis, which causes trichomoniasis, which is a sexually transmitted infection. And then for the fungi, mostly the common one is Candida albicans, which causes vaginal candidiasis. Okay, and then ectoparasites include the pubic lice, as well as scabies, which is caused by Sarcoptes scabies. Now, mode of transmission, we have already talked about that. It is either sexually transmitted, so it can be either be vaginal, anal, or even oral sex, okay, with an infected person, of course, okay. So if the person is not infected, the chances are you will not be infected, but this person is infected, and then you engage in sexual contact. Or if you come into contact with genital secretions, okay, these genital secretions that are infected, okay, or blood secretions that are infected, okay, either through like blood transfusion, or for the doctors who basically handle patients and you don't use gloves, okay, so you can actually come into contact with these secretions that are infected. Or if someone does a speculum exam, okay, and this person is infected, and then that speculum exam is not well sterilized and it's used to another patient, okay, it's very possible that that other patient, despite the fact that they did not engage in any sexual contact, they still get the infection. Okay, so this infection can also be transmitted through what we call a vertical transmission, and vertical transmission is from mother to child, and the mother to child can take place during time of birth, but also it can take place during breastfeeding. So if you are breastfeeding your baby, and especially infections such as HIV or even congenital syphilis, okay, and then as well as sharing contaminated equipments and sharp equipment and blood transfusion. And that's why screening is very important. For that blood, before it's given to someone, it needs to be screened well to ensure that the blood is safe, okay, for transfusion. So who are the people who are at risk? Number one, they are those people who basically engage in multiple or who have multiple sexual partners. Okay, so if you have multiple sexual partners, you are at increased risk of getting this infection. Or those people who engage in unprotected sex, or what we call the promiscuous sex. Okay, so basically you engage in more than anal sex, vaginal, oral sex at the same time, okay? So you can actually migrate these microorganisms from one site to another and to another, okay? And then, of course, we have talked extensively about congenital transmission or vertical transmission, and then as well as sharing of sharp equipments like needles, razors, and as well as transmission that comes through receiving blood products that are infected. So by far, those are the people who are at risk, okay, and who can easily get these infections, okay. So how do people present with these infections? Okay, so number one is the fact that they will present with genital or vaginal or what we call urethral discharge. And this discharge can be pus-like, it can be purulent, okay, foul smelling, or it can even be frothy, okay. And then there will be some genital ulcers, so there will be some wounds around the genital area or some blisters, okay. They might also present with itchiness. They want to just scratch themselves. There is a lot of irritation around the genital area or some burning sensation, okay, or around the genital area. Then they can also present with pain, okay, during the time of urination. Okay, so they feel pain when passing urine or pain when they engage in sexual activities. Okay, so pain on sexual contact or even some bleeding during time of sex. When you come to the hospital, some of the things that we'll be able to identify will include high temperatures, okay, or some rashes, okay, or some swelling of the lymph nodes. So lymph nodes basically help to trap microorganisms, okay, so they will be swollen. And then for patients who present with hepatitis B, sometimes they can present with yellowness of the eyes. Okay, but by far there are some sexually transmitted infections that do not present with symptoms, but which at the same time can cause long-term complications. And such infections include chlamydia, gonorrhea, or even hepatitis or human papilloma virus. So regular screening is very important. Okay, so what are some of the complications that can come with sexually transmitted infections? So number one is especially complications related to the reproductive system. Number one is pelvic inflammatory disease, and we have discussed extensively. You can refer to the previous video on pelvic inflammatory disease. Pelvic inflammatory disease can cause, number one, infertility, okay, because it can cause tubal blockage. It can cause ectopic pregnancy, okay, because now it slows down the movement of the egg from where it's fertilized to where it's supposed to be implanted, and it can also cause chronic pelvic pain. Now, infections such as human papilloma virus, okay, can actually cause cervical cancer, and it can also cause genital warts, okay. And then infections such as hepatitis can actually lead to complications such as chronic hepatitis, liver cirrhosis, okay, and to some extent it can cause what we call hepatocellular carcinoma. So those are some of the complications that you are expecting, especially in the reproductive system. Now, some of the complications you are expecting or are expected in pregnancy related include, number one, stillbirth. So you give birth to a baby that is already dead, okay, or recurrent miscarriages, or even preterm labor. Okay, we talked about urinary tract infections and their complications, and we say preterm labor is one of the major complications. And then the other thing is congenital infections such as HIV. HIV can be transmitted from the mother to the baby, or even congenital syphilis, congenital gonorrhea, congenital chlamydia, and hepatitis. And then systemic complications include neurological disorders. So syphilis can actually lodge into the brain, causing what we call neurosyphilis, which is one of the serious complications of syphilis, okay, or HIV-related conditions. And also there is an increased risk of co-infection. So once you have one infection, let's say for example you have chancroid, okay, which is basically an open ulcer, it means then you are at an increased risk of getting other infections such as HIV. How do you make a diagnosis? So diagnosis is made by, number one, good clinical history. So we listen to you and then we'll ask you some few questions, and then we go ahead and do examination. So we'll basically examine, and then we make an informed decision. And then after that, we can also, there are several tests that can be done, several screening for all those infections we have talked about that will be able to help reach a conclusion of the type of infection that someone might be suffering from. Okay, now let's look at how do we manage and how do we prevent. So the general principles for management is early diagnosis and prompt treatment. Okay, so early diagnosis means that once this infection has been gotten much more earlier, it means then it can be treated promptly. Okay, and then number 2 is contact tracing. We need to be able to treat the person who has that infection, but also contact the immediate sexual partners, and they also need to be treated. Okay, and then the other thing is, of course, we need to promote safe sexual practices that include use of condom, being faithful to one partner, and specifically if you can abstain, that will be the best way to control the spread of this infection. And then, of course, screening for co-infection. Once you come to the hospital and you are found with one infection, we have to screen you for the rest of the infections. How do you prevent? Number 1, of course, is abstinence. Okay, so you need to abstain from sexual activities, but then if you can't, okay, you need to practice what we call mutual monogamous relationships. Okay, so being faithful to one partner who is uninfected. Okay, now if you have to have more than one partner, it is very important for you to be able to use protective mechanisms to be able to prevent you from getting infections, such as use of condoms. Okay, and then there is other thing is, especially for those people who are at an increased risk. Okay, regular screening is very important. Okay, so you can just walk into the hospital and you just get this regular screening. Okay, test for HIV, VDRL, for syphilis, chlamydia, test for hepatitis B, regular screening, because we said early detection is very important for prompt treatment and recovery. Okay, and then of course prompt treatment of infected people. Okay, and contact tracing, very important. And then education. You need to be aware about these infections. Okay, you need to be aware that this infection exists and how do they get transmitted from one person to another, because education is the cornerstone to prevention of these infections. The other thing that has been advocated mostly is male circumcision. So circumcision has been shown to reduce the spread of HIV as well as the spread of human papilloma virus. And then we have vaccinations that are also available, like vaccination against HPV, human papilloma virus, which basically causes genital warts and cervical cancer. We have vaccinations available for hepatitis B virus. Okay, and recently we have seen as well vaccination coming up for HIV. So these are some of the vaccinations that are available that everyone needs to be given. Okay, so by far that is what you need to know about sexually transmitted infections. Now, if you present with any of these, okay, you can always visit us. You can always walk into Zawadi Premier Hospital and we'll be able to get a quality screen. Okay, so we'll be able to screen you and we'll be able to give you quality treatment for you to be able to prevent such kind of complications we have talked about. Now, if you are new here, please consider subscribing to our YouTube channel at Dr. Wills. You can also follow us in our social media platforms, and we will be very, very grateful. Until next time, God bless.